This is the start of a series involving making counseling point or going over counseling points of medications that pharmacists can expect to rehearse or recall when they need to counsel patients on how to take medication. So the point of the series is to just review these counseling points, and it's a low effort activity for me, but I think it might serve as an informative resource that gives pharmacists or pharmacy students an idea of what to focus on specifically. This includes going through the indication of the medication, like what are the main uses of this drug, what are the main uses of the medication, the mechanism of action, such as specifically pertaining to how the drug works, the directions on how to take the medication, including administration tips, such as deciding whether the medication can be taken with food or without, how should this medication should be taken, what happens if a dose is missed, and then dosing guidelines, including what is the standard dosing regimen, where we would consider the dosing strength, the dose frequency, the dose duration, and the route of administration. And then we also want to go into the side effects, which include what side effects we should be most concerned about, what the time frame for these side effects are, how we can manage these side effects typically. And then we also want to go into the interactions, such as what are the most common interactions these medications usually encounter, or what are the most common drug interactions or drug to food interactions patients usually encounter. We also want to go through storage tips, such as what the best temperature would be for the medication of interest, as well as where the medication would best be stored. Non-farms, these are mainly more condition dependent. Depending on the condition, you would determine like what would be the best measures to manage the condition. We also want to consider tips on how to adhere to the medication regimen, and then lastly, we also want to consider monitoring parameters such as efficacy parameters, such as looking for signs of improvement, including what we can expect from when we start this medication, and then when we can expect these effects to take place. Same thing for side effects or safety. We want to consider what side effects most typically occur and when they most typically occur. We also want to figure out how we can monitor for these side effects, and that's basically the basic template of how we would go over these medications.